first dose. But we had already given the first dose, so, but no, we're going ahead with the second dose. And as far as, we haven't gotten direction from any physicians to wait. So if we would get direction from physician, then we would, but we have not.
Okay.
But at this point, we gave the first dose, the recommendation was get it while you can.
Right.
And don't wait because you don't know when it's going to be available to
Right.
you. And only since then have they come out. And so there was a thing on Mayo that said wait 90 days, but I was going to vaccine saving strategy. So why give it to someone when you could give it to someone that hasn't had any sort of immunity yet?
Mm-hmm.
What we were told was if you have the opportunity to give it, just give it to them. And now there's no reason to wait now that they've got those.
Mm-hmm. Okay.
The next question, what is the time period following the second dose until full vaccination? I'll let Brandon answer that as well.
It could be anywhere from a week to 2 weeks. So after the second dose, what are we looking at is February 16th is 2 weeks after tomorrow. That's when we're going to assume that everyone has received their full immunity, or the 94.9% immunity. It kind of varies. Some people say a week, some people say 2 weeks, but we're going with err on the caution of 2 weeks, and that's when we're going to say immunity has been reached.
Okay. Brandon, could you also address what are we doing to reduce the effects of the COVID vaccine for the second dose, the side effects?
Most of our residents are already on some sort of Tylenol, whether it's scheduled or just available PRN. And I'm putting together a chart of who can have what when, so that way tomorrow and the next day we can stay on top of it with Tylenol, and that should help alleviate a lot of symptoms.
Okay. And then, will the vaccine work on the different variants they are discovering? Lila, would you like to talk about that a little bit?
Well, as far as, there's no conclusive evidence out yet, but as far as what I'm reading, it sounds like it will. Again, it's one of those things where there's a couple different variants now. So I guess we'll see. We don't really have any conclusive evidence either way, but it sounds like it will. We're kind of going forward with, that we're not going to be doing anything different based on, the variants, at least at this point, until we get some direction. So.
Okay, and actually in our chat box, one of our attending physicians has commented that residents are very high-risk patients, so the risk of getting COVID again is worse than the risk of side effects. So we are recommending not waiting. And then she also commented, yes, it works on all of the newest variants because of how it's made. So
Thank you for
that.
adding that.
I hope I can say it. That's from Dr. Schweizer. In fact, it might be public. I'm not sure. Yeah, to everyone, so you can all see that anyway. So thank you, Dr. Schweizer, and feel free to chime in anytime. Do family members have to have the vaccine in order to visit? The answer to that is no, not at this time anyway. I don't anticipate that it will ever be a mandate that you have to have the vaccine in order to visit here at Fairview Haven. It is not a mandate that staff have to have it at this point in time. And I don't anticipate that that will ever be a full mandate either. It may, like with the flu shot, there's very few exceptions that you can take in order not to have the flu shot if you work here at Fairview Haven. And we could get to the point where the COVID-19 vaccine is that way. But I think with as new as it is, I don't think anybody is interested in mandating it at this point. And so that is not the case. However, that being said, we do feel it's a good thing to have, and we'd highly recommend families getting it if you have the opportunity. I think that's all the information we have on the vaccine. Of course, we would be happy to entertain any questions about that at the end of the meeting, but feel free again to type them in the chat too if you would like. The next thing I want to talk about is phased reopening. So a couple things you need to understand, and I'm probably going to go way over your head with all of this because there's so much to try to keep track of. Understand that phased reopening is different for the state of Illinois than it is for nursing homes in the state of Illinois. So in the state of Illinois, there are 5 phases to the reopening plan, and we are currently in phase 4. We just came out of mitigation, and I'm not even going to go into that or what that all means, but all you need to understand is that we are in phase 4 here in the state of Illinois. That doesn't really apply that much to nursing homes. Nursing homes have 3 phases in which we have to work through in order to reopen our doors. And actually, we don't even reopen our doors on phase 3, but it gives us less restrictions each phase. Currently, we are under phase 1. We were in phase 3, if you might remember, back in October until we had our outbreak. And as soon as we had an outbreak, we had to go immediately to phase 1 in order to mitigate the spread of COVID. Did you say something? Yeah. So we have been at phase 1 since the start of our outbreak. Basically, what that means right now, anyway, we've gone through different restrictions throughout the outbreak when the outbreak was in pretty desperate situations. Then we had all the residents confined to their rooms, basically, and that has changed, thankfully. So right now, residents are allowed to come out of their rooms. They're allowed to gather in the living room as long as they maintain the 6-foot social distance. They wear their masks, things like that. Those needing assistance to eat are now eating in the dining room again. We have not opened back up communal dining for all the other residents because we're not allowed to do that under phase 1, but we are allowed to feed those who need assistance. We are doing some small group activities, but that's pretty limited. Some examples are we do have a church service on Sunday morning. Residents are allowed to come out for that. Again, social distancing is practiced, masking, things of that nature. Bingo, they play bingo, but they do generally ask the residents to sit in their doorways in the hallway. But a few residents are gathering in the living room for that as well. So we're just keeping our group activities very minor right now. Residents are able to move freely between buildings. So those in assisted living are now welcome back in the nursing home. They can come over and visit and participate in different things that are going on, which isn't much. The exception to that would be Serenity Villa. We don't let Serenity Villa residents come over here unless they have an immediate family member, then we are allowing them to come over. And Fairview Haven residents do not go to Serenity Villa yet at this point. Starting a week from today, if we have all negative tests this week, we will be able to move into phase 2. And I should rephrase that. If we have all negative tests that are not facility associated. So we could have a positive employee, but if it's not facility associated, we can still move to phase 2. We actually have been qualified to move to phase 2 for probably about a week or two. I think our last case, did I write that down somewhere? I think our last case, yeah, our last facility associated case was January 5th. And the last possible exposure that we had was January 21st. However, so we could have potentially moved into phase 2 by now, but we are restricted because our state region 2 was under mitigation efforts. And when you're under mitigation efforts, you're not allowed to move any phases. You have to wait 14 days after that mitigation is lifted. So that's why the February 8th date. But we fully anticipate, as long as, like I said, we have negative tests this week, moving into phase 2 on February 8th. So what does that mean? Oh, let me just say one more thing. Phase 3 then is if we have 14 days with no new positives, we can then move into phase 3. And I'm going to tell you a little bit about what we get in each of those phases. So phase 2, we get to open our beauty shop. And I know that's been something our residents and families have been begging us to do. And we're thankful that we're going to be able to do that. We have actually, as of today, I believe, we opened the beauty shop because we are kind of in that stage where, you know, technically we could be phase 2, but we're not really phase 2 because of the region 2. So we went ahead and opened the beauty shop today, feeling like there's not much risk, and are just allowing, at this week, it will only be residents that have already had COVID within the last 90 days. So that's how we're doing that. Starting Monday, any resident is welcome to use the beauty shop if we move to phase 2. And if we don't, we're going to have to talk about what we're going to do. Also in phase 2, we will be able to start communal dining. which means the residents will be able to come out of their rooms for all meals. We will go back to the way we were doing it before, which none of you got the opportunity to see, but we will set up a temporary dining room in the activity room just for overflow, because we will need to keep the residents 6 feet apart. We have 6 feet folding tables in our dining room. We put a resident on each end, and we'll do the same thing in the activity room then. Assisted living, I think actually we went ahead and opened today, maybe, right?
Yes.
And I believe independent living was open today. So those residents are actually being served in their rooms now. Those who wish to come out, they're not required to, but I believe all of them are. At least I haven't heard anything. There is one little issue that we're working out with the communal dining, and that is that it just so happens that we have to do some major repairs in the activity room next week, and so we'll be able to use our activity room for overflow dining. So we're trying to figure out how we're going to do that. So it may not be like full force communal dining starting Monday, but definitely by February 15th, we will be back to full communal dining. Any resident that wishes to come out would be able to come out for dining. Group activities will begin again starting February 8th under phase 2. The only thing would be residents do need to still wear masks. They do need to still maintain 6 feet of social distancing. Under phase 2, we are allowed to start implementing indoor visits from family members and friends. We have chosen, because the vaccine, we will be fully vaccinated the next week on February 16th. We have chosen to wait to open indoor visits until February 16th. And then we have full confidence that most 90% of our residents will have protection. And so I hope that's acceptable to everyone, but that's what we're going to plan to do. This is permitted under phase 2. So it's if we go back to phase 1, regardless of whether somebody is vaccinated or not, they will not be allowed to have indoor visits, because basically the purpose of the phases is to protect the unvaccinated, I guess you would say. And so we can't proceed with indoor visits if we're not in phase 2. So that's a phase 2 thing. But we will get to do that starting February 16th, Lord willing. And we also have to be under 10% positivity rate in Livingston County. And currently, the positivity rate, you guys don't even see. It's not, well, it is a public rate, but I'm sure you don't look at the site that we look at. But CMS publishes the positivity rate for every single county in the nation, and that's the positivity rate that we have to go by. And currently, the Livingston County, I believe, it's published every Monday morning, and it's as of Wednesday the week before. And I believe last Wednesday's was 3.5 or something like that. We've been in the 3 range for the entire month of January. So Livingston County is doing okay right now, and we hope to keep it that way so that we can keep moving forward. As far as indoor visits, some of the rules that we will need to follow per guidelines and regulations. First of all, they want us to tell you all that the visiting parlors and outdoor visits are always preferred. Obviously, you're not going to do an outdoor visit right now. We understand that. We're not even asking you to do that. But if the weather is nice, that's what we prefer, is that you do an outdoor visit if you can. However, if you come inside, you cannot visit residents that are under isolation or quarantine. That's pretty obvious. That would be for your protection as well. Visits must be scheduled in advance, and you would have to be screened in when you come in. I don't know if you've done parlor visits or outdoor visits. You've already gone through the screening process. The same screening process. You come in the front door. We have a kiosk. You enter in some information, answer some questions, get your temperature taken. Obviously, if you're sick, if you have any symptoms, please don't come. Please just stay home, protect our residents. And really, we also are interested in protecting our staff because, like I said earlier, about 55% of our staff did not get vaccinated. So that means they are still susceptible. Several of those have had COVID. But please understand we want to protect them as well because we don't really want to be having a staffing shortage for your residents. So if you're sick, if you have any symptoms, please stay home. Only 2 visitors from a household will be allowed to visit at one time for each resident. That's a state regulation. That's not a Fairview Haven regulation. We have to follow that. Visitors are only allowed in the resident room. You must maintain 6 feet social distance, avoid physical contact, wear face covering, and practice great hand hygiene when you're in the building. So basically, you'll come in, you'll screen in, you'll go directly to your loved one's room, have your visit, and then you'll exit the building. I guess if you absolutely have to use the bathroom, you can use the bathroom. But other than that, we ask you not to hang out in the lobby. Don't go into other resident rooms. If you want to schedule a visit with another resident, you may do that, but we just need you to be only in the resident rooms. Also, starting February 16th, we will be starting up some more volunteers. For example, the water passing, we used to always have volunteers for that. We're going to start doing that again. Basically, anything that is an essential service, we can start having volunteers come in and do. So we are working on that. Trish Steiniger, our volunteer coordinator, is putting together the program for us, and we'll be contacting volunteers and letting them know that they're welcome to come back in. Of course, again, if you're, high risk and don't want to come in, that's perfectly acceptable. Under phase 3, things loosen up a lot more. For example, group activities, we'll be able to have a volunteer come in for those. Again, we will probably max that out at 2 volunteers per activity and of the same household. Also, in phase 3, we get outings. The residents will be able to go on outings. When they go on outings, there are some rules that we're going to ask that they follow. First of all, continue to use caution, wear a mask, social distance, avoid meals, or if you're going to eat meals with them, make sure you properly distance while you're eating the meal when you don't have masks on. And then follow IDPH COVID-19 guidance. So right now in Illinois, under phase 4, it says that you shouldn't be gathering in groups of more than 50. We're going to ask that our residents not be participating in activities that are more than 50. Ensure proper hand hygiene, avoid physical contact, and then if they're out overnight, which is unlikely, but if for some reason they would be out overnight, this again is a regulation, and we're still kind of discussing how we can get around it. Basically, if they're out overnight, they have to quarantine when they come back for 14 days. Quarantine meaning that they are to stay in their room except for exercise or medical purposes, and they would have to wear a mask whenever anybody's around them, which they basically have to do that anyway. Supposed to do that. So what does vaccination change for residents in these phases? And basically, like I said at the beginning of the call, the government is telling us to do everything as if vaccination didn't exist. Yet understand that, we can support that. And so what we are doing is looking at the regulations and trying to figure out what can we do, still following the regulations and yet loosening things up for our residents that have chosen to get the vaccination. So number one, and this is actually IDPH answered a question on one of the conference calls that they had with providers. And the question was asked about outings and what about residents who have had the vaccine or who have had COVID, can they go out on outings? And they didn't outright answer that question, of course, because they can't be liable for their answer. But the way they did answer it was, well, I mean, they have the right to leave the building if they want to leave the building. So we took that as if you've been vaccinated or you had COVID, we're going to let you leave the building anytime. So starting February 16th, when full vaccination is in force, we feel it is perfectly safe for our residents who are vaccinated to leave the building, to go on these outings, as long as they're following the descriptions that I stated. Great. The reason that they still have to follow the precautions is because the government is basically, or not the government, but healthcare institutions are basically saying the vaccination is to protect you from getting sick. It is not necessarily, it hasn't been proven yet to protect you from carrying the virus or being an asymptomatic carrier. There's a lot of discussion out there that, if you're asymptomatic, you're not really able to spread it. I don't know. I'm not a doctor. I'm not an, whatever that other word is that starts with an E. Yeah. epidemiologist or whatever. I have no education in that area, so I'm not going to claim to know anything. However, I would think that if you can't get sick, you're pretty protected. But as I talked earlier, there are some residents that have chosen not to get vaccinated, which that's their choice. And there are some employees that have chosen not to get vaccinated. We can't afford to have 50% of our staff out with COVID. So we do still have to maintain some precautions, but I do think that we have to be reasonable as well. And that's why I feel like it's very safe to allow those who have been vaccinated to leave, even if we're not in phase 3. So starting February 16th, we won't be in phase 3 yet, but those who have been vaccinated will be welcome to go on outings.
Yeah.
Also, when it comes to testing, we're still looking at this and still trying to figure out what the regulations really mean. But we are not planning to test those who are asymptomatic who have been vaccinated. We feel like there's no need for that. We don't need to know whether or not they're going to be symptomatic. We don't need to know whether or not they're going to get sick. So it would be our decision or our recommendation that residents who have been vaccinated would not have to be tested any longer after February 16th.
There you go.
We don't have clearance on that yet, so we're still kind of debating that. Not sure how we're going to handle that. At this point, it's kind of a mute issue because if we get cleared this week, we would go to routine testing, and under the routine testing, we don't need to test our residents. So it would only be staff members that would be tested. Getting into testing, again, I talked a little bit about facility acquired, facility associated case, just to explain kind of what that means. So we have a facility, if a resident would test positive, they don't count against us in any way if it's not facility acquired. And what that means is we have residents that are admitted to us from other facilities or admitted to us from the hospital or even from the community. They are on, if they haven't had COVID and they've been vaccinated, for sure, they will be isolated for 14 days. During that 14-day period, if they contract COVID, test positive for COVID, then that is not considered a facility acquired case, nor is it any risk to any of our residents because they're isolated. They're not exposing anyone. So if it's not a facility acquired case with the residents, it's not any risk, and therefore no testing is triggered from that. If it's a facility associated case, what that means is that's a staff member that basically contracted it at Fairview Haven. So if there is a epilink, is that how you say that, between that case and another case, then that would be considered a facility associated case, and that would mean we have a problem that we need to mitigate. And that's basically what we've been dealing with since October is facility associated, facility acquired cases. Since January 5th, we have not had any facility associated cases. We have, however, had a few cases of staff members that were in the building while they were positive, not knowing they were pre-symptomatic, that tested positive, but we could tie that back to somewhere else. And so it wasn't a facility associated case. However, because they were in the building, we have to continue to test until we get negative tests. So that's what we've been working on. I probably lost most of you by now, but I'll keep going. And again, feel free to throw in your questions there. So according to the testing guidelines, there's 3 phases of testing. There's symptomatic testing. So we will be doing symptomatic testing forever. Let's just say that until COVID is no longer an issue. But we will continue to test anyone that presents with symptoms. If they're positive, then we go into repeat testing. And what repeat testing is we test all staff members for sure to see if there's anybody else that's positive. We have to do that for 14 days, 3 to 7 days apart. So we have to do it at least 2 times and make sure that there's no new positives. If there is new positives, we continue to test again until we have 14 days of no new positives. That's what the repeat testing is. We also have to test residents if they're involved and they're exposed. Again, that's where we're a little bit iffy and we're trying to work out the regulations yet on whether or not we would have to test those who have been vaccinated. We do not test those who have had COVID in the past 90 days. And so our theory would be if we're not testing them, why would we have to test those that are vaccinated? So basically, if we have no new cases this week, we go into routine testing, which is the third form of testing. That is done based on where your county falls on that positivity rate that I talked about earlier. As long as our county positivity rate is below 5%, then we only have to test monthly. And so we will be testing our staff, at least those who have not been vaccinated, on a monthly basis going forward after this week, if we can go into routine. Under the routine testing, residents never need to be tested. So as long as we stay in routine testing, residents will never be tested.
Unless they're symptomatic.
Unless they're symptomatic, that's correct. Or there's other symptomatic residents who test positive. So I think, and then as far as the positivity rate, if it's between 5 and 10%, then we have to test weekly. And if it's over 10%, then we have to test twice a week. I think that's all that I wanted to say on the testing. And then I just have one more comment on independent living residents. I don't know if I have any families from independent living. I think I have a couple residents. We do have two different types of residents over in independent living currently. So we have what we call community dwellers. And basically we created this, I don't know, it's been a couple months ago, before the outbreak. And we told the residents over there, look, if you guys want to be able to go out and do your thing and do whatever you want, then we're going to make you a community dweller. And what that means is you come and go from your apartment, but you have no interaction with residents within our building, and you have no interaction with staff within our building. So as we move forward with phase 2 and phase 3, basically we're kind of revisiting that community dweller. That's still an option. So anybody back there that wants to be a community dweller can do that. They still would have no interaction with staff and residents. But understand that with these new releases, so if you've been vaccinated, you can now leave whenever you want anyway, as long as you're following the guidelines that we laid out tonight. So if you want to, just go be with your family, that's going to be perfectly acceptable now as a vaccinated resident. So you don't necessarily need to be a community dweller anymore. You now can have interaction again if that's all you're doing. Now, if you want to go to a gathering of more than 50 people, go to a wedding, or if you don't want to wear a mask, or if you don't want to follow the state guidelines, then you can still be a community dweller, but we won't let you be interacting with our residents and staff. So it won't change for you if that's what you wish to do. So hopefully I've made things clear. Hopefully I've given you good information, and I know there's questions. So maybe I'll have Sally ask the questions, and then we'll take turns answering them. Yeah.
So once the dining room reopens, will unvaccinated residents and staff be allowed in, or will they be restricted?
Yeah, so once we're into phase 2, basically the only difference between vaccinated residents and unvaccinated residents will be that the unvaccinated will only be able to do outings under phase 3 according to the guidelines of the state of IDPH. Those who are vaccinated will have the right to go out. I mean, you all have the right to go out, I guess. You can disobey the guidance, but we have to tell you that, you can't go out if you're in phase 2 and you're not vaccinated. Really, going forward, those who are vaccinated really do not have a risk of getting sick any longer, and therefore there's no danger in having unvaccinated residents mixing with them. The danger would be for those that are unvaccinated. They could possibly still get the virus. And so if they choose not to come out to the dining room, that's a choice they can make. So basically what the vaccination does is it says you have an option now to protect yourself. We don't have to, everybody else doesn't have to take steps to protect you. So we're still going to follow the safety protocols because we're asked to do that by the state. But yes, we are going to allow unvaccinated residents and vaccinated residents to participate in activities in communal dining.
There's just one other comment that says being hydrated before and after the second shot is supposed to help with side effects. And thanks for that helpful comment.
We will note that for sure.
Just the organizer. Are you asking visitors if they've been vaccinated?
Yeah. We addressed that question. Are you asking visitors if they're being vaccinated, if they've been vaccinated? We will not be asking that question, and that is not a mandate in order to visit. Again, it's, you know, it'd be wonderful if you get it, but we're not mandating that. That's a personal choice that everybody has to make.
It'd be better for us and you if you were.
Right.
If I have a question,
Okay.
can I? If my mom will say, if you have had COVID in the last 90 days and you haven't been vaccinated, but you want to wait until that 90 days is over,
Mhm.
can you still, on February 16th, can you still eat in the dining room or go out and come in and out and be part of the Fairview Haven community?
Yes. Yes.
As long as we don't go back to phase one.
Right. As long as we don't go back to phase one, as long as we're
Okay.
in phase two, then she can participate in everything that is allowed under phase two. And also,
Okay.
because she's had COVID in the past 90 days, I would say, I mean, we can't say that she can go on outings, but I would say she's probably safe to go on outings because they're saying that that 90 days is a safe period. But again, there's not evidence to actually say that within the regulations and so forth.
Right. So you would say we could pick her up and take her somewhere and she could come back and she could still eat dinner there with her friends or play games with her friends or whatever. So that's right.
I can't answer that question in the affirmative, but I can say that she probably isn't at much risk.
Okay. All right. Thank you.
According to the IDPH guidance, she's not supposed to go out, but that's what I have to say.
Are you making any adjustments to resident care assignments per shift? My concern is a nurse or aide who is not vaccinated is being assigned to take care of a resident who is also not vaccinated.
Again, that everybody has had the choice to get vaccinated or not to get vaccinated. If you chose not to get vaccinated, you know, that was your choice. And so at this point, I don't feel like it's our responsibility to look at who's vaccinated and who's not vaccinated. And please don't get me wrong. We obviously want to protect all of our residents, and we love those who didn't get vaccinated too. But it goes into, you know, we are not going to mandate vaccination. I would hope that you wouldn't mandate that we go to extra efforts to continue to protect your loved ones who choose not to get vaccinated as well.
If you go back to prior phases, does that then change what the vaccinated residents are allowed to do?
It does not totally change what the vaccinated residents can do. Vaccinated residents will always be able to go on outings. Vaccinated residents, at this point, we can't say this for sure because we don't have true guidance and we don't know how to get around the regulation yet, but they will not need to be tested. They definitely can continue to go on outings. We have documentation that gives us, you know, a comfort level with that. So that is one thing they will continue to be able to do. As far as visitors, they will not be able to have visitors, and that's because it's a facility-wide, you know, that's affecting the facility. People are coming into the building, whereas if a resident is leaving the building, that's only affecting that resident. So that vaccinated resident is safe to go out of the building. Basically, the visitors is pretty much saying, okay, COVID is in the area, so we want to keep COVID out of the building, so we're going to lock down again and not have visitors in the building. That's the difference between saying anybody can come in or saying you can go ahead and go out. Because the residents that are vaccinated should be safe to go out. I hope that makes sense. If it doesn't, please ask or tell me to clarify. And if you would like to ask a question, if you have the ability to unmute, we'll maybe start with that. Before we close everything, I will unmute everybody because I think maybe those on the phone, I don't know if you can unmute yourself or not. So if you want to try to unmute, that would be great. So it's just one person at a time. Or again, continue to type in chats.
Does your staff wear N95 masks and shields with all patient encounters, or just surgical masks and face shields? If you're not using N95 masks, why not?
That is a very good question. So we have wearing N95 masks and face shields where possible. Some staff members are not medically able to wear N95s and have medical clearance not to. But for the most part, and definitely during the outbreak, I would say most everybody was wearing N95s and face shields. They continue to do that. We are getting to a point where the guidance would say they're not required any longer. We haven't made a specific determination on that yet, but I would say very soon we are going to be telling our staff they no longer have to wear them. They will always, not always, but until we get through COVID, they will be wearing face shields or surgical masks, but not N95s. N95s are only needed according to CDC guidance if there is an outbreak, or if there is, I believe it actually says in the guidance that if it's 10% positivity rate in the county, then we would have to wear N95s. And of course, we do monitor other counties nearby us as well. So definitely we'll monitor that, but very soon we will be telling our staff they do not need to wear N95s any longer. Good questions.
I'm gonna ask Dr. Schweitzer if she has anything to add.
Yeah, I don't know, Dr. Schweitzer, if you're still on the call, if you have anything you want to add, information.
No, not really. Other than to say, if you haven't made a decision to vaccinate your loved one, I would strongly encourage it, because really, we've seen several people vaccinated. The risks of a serious adverse reaction is about 2 per every 1 million doses given, and your loved one's risk of dying from COVID is greater than that. And so please vaccinate your loved one if you haven't. And otherwise, I just want to say thank you very much, Dave, for all of your staff. You guys have done just a fabulous job taking care of all of the residents during this outbreak. And I think the fact that we've lost some, but not a lot compared to other facilities, really shows just how diligent you guys have been at taking care of everybody. So thank you very much.
Well, thank you. I appreciate those kind words. I have to tell you that I have been very thankful for the support that I get from our families. You all are amazing, and I know it's been a really hard time for our residents and for each of you, and you've stood behind us and you've supported us, and I just thank you for doing that. It's been hard, but we've been blessed. I would just say on Dr. Schweitzer's comment on the vaccine, I know those of you that weren't on the last call, Dr. Steffen would echo those words if he's your physician. And I'm not sure other attending physicians, but I know that every physician that I've talked to is very supportive, especially for those in the nursing home, those in the age group that your loved ones are. Do consider it. It's important. I will go ahead and unmute all, and it's going to get crazy. Actually, Beth, do you have a question? It looks like you unmuted yourself.
Yeah, just curious if you know how many residents, like what percentage have chose to get vaccinated. Are you willing to share that information or able to share that information?
Yeah, I shared it earlier on the call. You maybe weren't on yet, but 90% of the residents on our campus have received the vaccination as of on January 5th. I don't know for sure if any new ones will be getting vaccinated tomorrow or not. We have new admissions that will be, but I don't know if any of those that were here January 5th, are there some?
A couple that have changed their mind.
Okay, so there are a couple that are getting it tomorrow as well. So probably over 90% will be vaccinated by the end of March, or by the beginning of March. And if your loved one isn't vaccinated and you would like to get them vaccinated, it's not too late for tomorrow. Livingston County is coming at 7:30 in the morning to do staff, and I think they'll start with residents about 8:30. So let us know if you want them vaccinated if you're on the call and they haven't been. Anybody else want to unmute themselves? Otherwise, I'll unmute everybody. And maybe when I do, if you know how to mute yourself, go ahead and mute yourself so that you don't disrupt everybody. You're all unmuted. Don't talk about me. But feel free to ask questions. Well, they muted. Any more chats? Well, I take from your silence that we gave you all the information you were looking for. If not, you can always email us, you can always call in, you can always text us. We're here for you. We're not trying to be hiding anything. One of the comments that I got when Sally was calling everybody was that we need to update the status on the website more often. And I apologize for that. That's my fault. I will say, though, that we haven't had a lot of changes in the last few weeks. So that's actually a good thing. But yeah, we do need to update that a little bit better. I'll try to, well, hopefully we won't need any more updates, but I do apologize for that. During the outbreak, it did get a little bit crazy, but we still want to communicate with you. So please feel free to email us, and just understand that it may take us a couple days to get back to you, but we will eventually respond. There's another comment there. Is that just a thank you? Okay. Okay, well, if that is all, we will close up, and thank you all again for joining us. Thanks again for all your support over the last several months, and we'll probably have more of these in the future. Good to see some of you on the screen, and good to hear from some of you as well. So thank you very much, and have a nice evening. I will stay on if anybody wants to chat or anything for a few minutes, just in case. I think we're going to go ahead and disconnect. So thank you again.
That was so strange that it would say